If you're over the age of 60, this is something you shouldn't ignore. Most people think that once they lie down and close their eyes, their heart finally gets a chance to rest. But what if I told you that something millions of older adults do every single night may actually be making the heart work harder instead of allowing it to recover? The concerning part is that this often happens without causing any pain or obvious warning signs. That's exactly why so many people never realize there's a problem until much later. Before we finish, I'll also explain a nighttime symptom that many people assume is just a normal part of aging, even though it can sometimes be an important warning signal. I'm glad you're here because understanding what happens inside your body while you sleep can help you make better decisions for your long-term heart health. Your heart never takes a break. Every minute of every day, including while you're asleep, it continues pumping blood, delivering oxygen, repairing blood vessels, and supporting every organ in your body. During healthy sleep, your body enters a recovery mode. Blood pressure naturally drops, your heart rate slows down, stress hormones decrease, and your cardiovascular system finally gets the opportunity to repair itself after the demands of the day. But certain bedtime habits can interfere with this natural recovery process, forcing your heart to work when it should be resting. The problem is that you usually can't feel it happening. One of the biggest mistakes I see is eating a large meal or a sugary snack shortly before going to bed. It doesn't seem dangerous. In fact, many people believe a small bedtime treat helps them sleep. But once you eat, your digestive system immediately goes to work. Your stomach, intestines, pancreas, and liver all become active. To support digestion, your body redirects more blood to the digestive tract, which means your heart has to pump harder. At the same time, blood sugar rises, insulin levels increase, and your metabolism remains active when it should be slowing down for the night. This becomes even more important as we get older. Our metabolism naturally slows with age, and the body often becomes less efficient at processing sugar late in the evening. Research has consistently shown that regularly eating heavy meals late at night is associated with poorer metabolic health and may contribute to conditions such as obesity, type 2 diabetes, and cardiovascular disease over time. One late-night snack won't cause a heart attack, but repeating the habit night after night for years may gradually increase your risk. But here's what surprises many people. Food isn't the only issue. There's another bedtime habit that may be even more common, and chances are you've done it yourself. Before I tell you what it is, it's important to understand why quality sleep is one of the greatest gifts you can give your heart. When you fall into deep restorative sleep, your nervous system shifts into what's often called the rest and recover mode. Your blood vessels relax, your blood pressure falls naturally, your breathing becomes slower and more regular, and your heart doesn't have to work as hard. Think of it as your body's overnight maintenance program. Every healthy night of sleep gives your cardiovascular system another opportunity to repair tiny amounts of wear and tear that naturally occur during the day. Unfortunately, many people unknowingly interrupt this process before their head even touches the pillow. Instead of allowing the brain to prepare for sleep, they keep it stimulated until the very last minute. That's where screens become a hidden problem. Whether it's scrolling through social media, watching television, checking emails, or reading upsetting news on a phone or tablet, bright screens send a powerful signal to the brain that it's still daytime. This suppresses the release of melatonin, the hormone that helps regulate your sleep cycle. At the same time, emotionally stimulating content can increase stress hormones like adrenaline, keeping your brain alert when it should be winding down. The result isn't always obvious. You may still fall asleep, but your sleep can become lighter, more fragmented, and less restorative. Large population studies have found that poor sleep quality is linked with a greater risk of high blood pressure, heart disease, stroke, and even cognitive decline later in life. That's one reason sleep specialists often say it's not just how long you sleep that matters, it's how well you sleep. Many older adults tell me they spend 7 or 8 hours in bed every night, yet they still wake up feeling exhausted. If you're tossing and turning, waking several times, or feeling tired every morning, your body may not be getting the deep restorative sleep your heart depends on. And the next bedtime habit I'm about to discuss may be one of the reasons why. Let's talk about another habit that often surprises people: Many adults believe that having a glass of wine, a cocktail, or another alcoholic drink before bed helps them sleep better. It may feel relaxing at first because alcohol can make you feel drowsy, but that's not the same as getting restorative sleep. As your body begins to process alcohol during the night, your sleep becomes lighter and more fragmented. Your heart rate may stay higher than normal, your breathing can become less stable, and you may wake up several times without even remembering it the next morning. For older adults, these effects can be even more noticeable because sleep naturally becomes lighter with age. If you've ever wondered why you sleep for 8 hours but still wake up tired, this could be one piece of the puzzle. Now, here's something that many people dismiss as simply getting older when it may deserve a closer look. Waking up once in a while to use the bathroom is common, especially as we age. But if you're waking up 2, 3, or even 4 times every single night, don't automatically assume it's harmless. Frequent nighttime urination can sometimes be linked to conditions like diabetes, uncontrolled high blood pressure, sleep apnea, an enlarged prostate in men, certain medications, or changes in how the heart and kidneys are working together. The important message isn't to panic, it's to pay attention to patterns. If this has become your normal for weeks or months, it's worth discussing with your healthcare provider rather than simply accepting it as part of aging. There's another nighttime symptom that often catches people off guard, a racing or pounding heartbeat that wakes you from sleep. Sometimes it lasts only a few seconds. Other times, it continues for several minutes. There are many possible explanations, including stress, dehydration, excess caffeine, certain medications, or harmless palpitations. But in some cases, it can also be related to an abnormal heart rhythm that deserves medical evaluation. The sooner these problems are identified, the more treatment options are usually available. That's why it's always better to ask questions early than to ignore symptoms and hope they disappear. Hydration is another area where balance really matters. Many people intentionally stop drinking water early in the evening because they don't want to wake up during the night. Others drink several large glasses right before bed because they realize they haven't had enough water during the day. Neither extreme is ideal. Dehydration can make the heart work harder because there is less fluid circulating through the bloodstream. At the same time, drinking excessive amounts just before bed may interrupt your sleep with repeated trips to the bathroom. A much better approach is to stay well hydrated throughout the day and simply avoid consuming large amounts of fluid during the last hour or two before bedtime, unless your healthcare provider recommends otherwise. There's one more factor that doesn't receive nearly enough attention, and that's emotional stress. Your heart doesn't distinguish between a real emergency and a stressful thought. If your final hour before bed is filled with upsetting news, heated online arguments, financial worries, or replaying stressful events from the day, your brain may continue producing stress hormones long after you've turned off the lights. Elevated cortisol and adrenaline can keep your nervous system activated, making it harder to reach the deep stages of sleep where healing takes place. Night after night, this cycle may contribute to higher blood pressure and place unnecessary strain on the cardiovascular system. That's why I encourage many of my patients to create a simple bedtime routine that signals to the brain it's time to relax. It doesn't have to be complicated. Reading a few pages of a book, listening to calming music, practicing slow breathing, gentle stretching, or writing tomorrow's tasks on paper can all help quiet the mind. These small habits may seem insignificant, but over months and years they can support better sleep quality, improve energy during the day, and help create the conditions your heart needs to recover each night. The truth is that protecting your heart isn't about finding one miracle supplement or one magical food. It's the small choices you make every day that often have the greatest impact over time. A healthier dinner schedule, fewer late-night screens, better sleep habits, regular physical activity, stress management, and routine medical checkups all work together. None of these changes has to be perfect. The goal is steady progress because small improvements practiced consistently are far more powerful than dramatic changes that only last a week. So tonight, before you go to bed, take a moment to think about your own routine. Ask yourself if there's one habit you could improve starting today. Your heart has been working every second of your life without asking for a break. Giving it the best possible environment to recover while you sleep is one of the most valuable investments you can make in your future health. I'd love to hear from you. Which bedtime habit surprised you the most, and which one are you planning to change first? Share your answer in the comments because your experience may encourage someone else to make a healthier choice tonight. If you found this video helpful, consider sharing it with a friend or family member over 60 who could benefit from this information. And if you enjoy practical, evidence-informed health advice explained in plain language, subscribe and turn on notifications so you don't miss our next video. Taking care of your heart begins with the choices you make today, and sometimes the smallest change before bedtime can make a meaningful difference for the years ahead. Before you leave, let me share one final thought that I believe is just as important as everything we've discussed so far. Many people spend years searching for a single medication, one special vitamin, or the latest health trend that promises to protect the heart. But in reality, the strongest protection often comes from the simple habits you repeat every day. Your bedtime routine is one of those habits. It may seem ordinary, but over months and years, those small choices can have a meaningful impact on your overall health. Remember, your heart is one of the hardest working organs in your body. By the time you reach your 60s or 70s, it has already beaten billions of times without ever taking a day off. Every night, while you're asleep, it's still delivering oxygen, nourishing your organs, and helping your body repair itself. The least we can do is create the right conditions for it to perform that job as efficiently as possible. I also want to remind you that information like this is meant to help you become more aware of your health, not to create fear. Many of the habits we've talked about today can be improved gradually. You don't have to change everything overnight. Even replacing one unhealthy evening routine with a healthier one can become the first step toward better sleep, improved energy, and long-term cardiovascular wellness. And please don't ignore your body's signals. If you frequently wake up gasping for air, experience chest pain, notice swelling in your legs, have repeated episodes of a racing heartbeat, or feel unusually short of breath, those symptoms deserve medical attention. They don't always mean something serious is happening, but they should never be dismissed simply because you're getting older. Early evaluation often leads to earlier treatment, and in many cases, better outcomes. One question I hear all the time is it too late to improve my heart health after 60? The encouraging answer is no. Research continues to show that healthy lifestyle changes can provide benefits at almost any age. Better sleep, improved nutrition, regular movement, managing blood pressure, controlling blood sugar, avoiding tobacco, and staying socially connected all contribute to healthier aging. Your body has an incredible ability to respond positively when you consistently give it what it needs. So tonight, instead of thinking about what you have to give up, think about what you're giving yourself. You're giving your heart a better chance to recover. You're giving your brain the deep sleep it needs to function well. You're giving yourself more energy for tomorrow and hopefully more healthy years with the people you love. Now I'd like to hear from you. How old are you and where are you watching from today? I read as many comments as I can, and it's always inspiring to see viewers from across the country supporting one another on their health journeys. If you have a bedtime habit that's helped you sleep better or improved your heart health, share it below. You never know whose life your experience might help. If you found value in today's discussion, please take a moment to like this video and share it with someone you care about. A simple conversation about healthy bedtime habits could encourage a friend, spouse, sibling, or parent to make a positive change. And if you're interested in learning more about protecting your heart, brain, and overall health as you age, subscribe and turn on notifications. We'll continue exploring the latest evidence in a way that's practical, easy to understand, and focused on helping you live a healthier, more active life. Thank you for watching, take good care of yourself, and I'll see you in the next video.